Time for us to dive into our first career in healthcare, being a medical assistant. The team at Labette Health in Southeast Kansas is here to help us understand why a medical assistant's day is nothing but routine and could be a gateway to exploring other careers in the healthcare industry.
Growing up, I saw my mom working as a CNA at residential homes and then a couple hospitals, and then she finally finished her RN and her BSN at Oklahoma Westland down in Bartlesville, and I really loved her commitment to the career. When I got to high school, I really saw this phlebotomy class, so I wanted to take phlebotomy. My mom thought I was crazy because I was scared of blood and needles, but I did it and I passed the phlebotomy exam, and I did my clinicals with my mom down in Bartlesville at the hospital.
I found out about the medical assistant program because I had started doing my prereqs. I didn't know really what I wanted to do yet, so I started doing the prereqs there, and I found out about the medical assistant program just through word of mouth on campus, and it really interested me, so I went and talked to the director there and got into the program.
My daily tasks are, when I get to the clinic, I will check our voicemails and make sure I don't need to call anybody back right away, or I don't need to take care of something right away. Then I'll get onto my computer and check my patients list to see if I need to pull any shop records or for them, or need to check if they need any medication updates for that day. Then once the patients start arriving, I will get their weight, their height, then I'll take them to a patient room and get their vitals, their blood pressure, their temperature, their pulse ox, and their heart rate and their respirations. And then I go and speak with the provider saying, this is so-and-so's here for this, and you need this for them, and here are their shot records if they need shots, here's their medication list if it needs updated. That part is when it's the provider's turn.
I work in a specialty office, an OBGYN office. I assist a nurse practitioner, and whenever I call a patient back, I get their vital signs, their blood pressure, their pulse, their weight. I also ask them questions about if certain medications that they take. In an OBGYN office, I usually ask about mammograms and pap smears. I also help if our receptionist is busy. I am trained to check patients out, check them in. I also know how to reschedule a bunch of our patients. And then if the nurse practitioner can't make it in that day, I will assist the receptionist on calling patients and moving patients on our schedule. I also call all of our patients back with results, and I also do a lot of paperwork. I do what we call a tickler file. It's letters that we send out to patients as reminders for appointments and things like that. So there is a paperwork side of it too.
What I would say to people in high school thinking about where they want to go with their life, and if they want to start in a medical field position, I would say to start with a medical assistant, because it really gets you going, and you get to see where you want to be, because you get to do lab stuff like phlebotomy or work with lab equipment, or if you want to work with people, you get to see how to work with people.
Skills that I think are important for medical assistants is that you want to make sure that you do have people skills, and you need to think on your feet pretty fast sometimes. I absolutely love being a medical assistant, and I love my job, and I've gotten to know a lot of different people in different ways, how the job, different roles. If you work in a family practice setting, it's a lot different than working in a specialty office.
What I love about being a medical assistant is I like to work with a different range of ages. And I enjoy the younger ranges because they're a lot more fun, and they definitely lighten up my day throughout the day. I like to work with people. I'm a people person. I love just talking to the people every day. I love calling them to make sure they're doing okay, or if they need a medication refill, I love getting it for them.
I love being a medical assistant because I get to know new patients. I learn different things almost every day, and to help them get better, or new moms, it's very exciting to tell them that they're pregnant because it's super exciting. And then I also love our elderly patients that we see. You get to know them very well as well.
Our medical assistant panel to answer questions about this career opportunity. Joining us this morning from Labette Healthcare our medical assistants Maggie Simmons and Ashley Walker. Good morning, ladies.
Good morning.
So great to have you taking some time with us this morning. And thank you for giving us that behind the scenes look at what it's like to be a medical assistant. Was it hard to do the interview and then show what you do?
It was kind of hard for me. I work in a specialty office in women's health, so it was interesting though.
It was very interesting.
Well, we appreciate you guys giving us that sneak peek. So we learned a little bit about why you became medical assistants. Can you share with us what your path was, how long it took you to reach where you are today?
Whenever I got into the medical assistant program, it was actually a 2-year program. And when you graduated with your associate's degree in science. But now Maggie did it a year ago.
Yeah, my program was a year, and you didn't have to graduate with your associates. You could have just graduated with the certificate. I only graduated with the certificate.
So it's changed.
And where did both of you go to school to earn your certificate and your associate's degree?
I went to Coffeyville Community College.
I also went to Coffeyville Community College.
Awesome. So what are some of the most common clinical tasks you perform as a medical assistant?
For me in a specialty office, I will call patients back and I will get their vital signs, which is weight, blood pressure, respirations, pulse, temperature. And then I also will take them back to the room, and we do a lot of well woman exams, which are like a pap smear, breast exam, and we also order mammograms, and I assist a nurse practitioner in the exams.
For me, I work in the rural health clinic. I do a lot what Ashley does, but I work with more like urgent care stuff, so sick visits. So I'll swab you if you're sick for flu or COVID or strep, and I do a lot of like calling patients with their test results.
So how do you assist? You mentioned that you work with the nurse practitioners, but how do you assist healthcare providers with patient care during office visits? Are you standing there next to them, or are you taking the lead on some of those procedures?
For me, I will stand next to them during the exam and I will hand them instruments. I also assist with birth control insertions of IUDs. And whenever they ask for lab draws, I'll draw their labs, give the injections. And if she needs assistance with anything else, I assist with that as well.
I assist with injections and lab work. I really don't have the opportunity to do well woman exams. I really just do express care and primary care visits. But other than that, I would help if I had the chance.
So you both have had your journeys to where you are today. Is there something that might take you to a different route? One of the things that we heard or have learned about is that as a medical assistant, you do get exposure to a lot of different types of careers in the medical career industry. Do you see this maybe leading to you doing something different in the future?
For me, no. I love my job and I've been doing it for 10 years. So I plan on staying where I'm at. I love women's health. So
For me, I just started my medical assistant career. So in the future, possibly moving on. But as of right now, no.
Well, getting back to the duties of your jobs, how do you ensure the safety and the cleanliness of an exam room or the medical equipment?
In our office, so we will tear the table paper off, we'll wipe it down with like sanitation cloths. And then for instruments, we will rinse them off and put them in a bucket. And we actually take our stuff down to our hospital central sterile.
Since I work in Independence at the Rural Health Clinic, we also tear off the paper, wipe down the rooms, and then with our instruments, we rinse them off and put them in a bucket to send to Parsons to get them sterilized.
Can you share a particular rewarding experience you've had as a medical assistant with us?
Mine would be there was a particular patient that we would see every 3 months for a procedure that we did. And we had seen her for a good about 4 years. And so I kind of got a little attached to her. She was a sweet little old lady. And when we would do the procedure, she would always ask updates on my family and stuff like that. And when we would finish, she would always just give me a big hug. And one time we danced around our room because she was just so happy because she said that we had changed her life and made it better. She was able to sit and do puzzles with her husband that was in the nursing home. So that was my most rewarding.
For me, I have this patient that she sees a lot of providers at the Express Care, but she came in on her birthday and we got to throw her a big birthday party. And she is just the sweetest little lady ever.
I can imagine having your patients see you on a routine basis. They get attached to you as well. So what's today going to be like for you after you finish spending some time with us this morning?
So I will go back to the clinic and we have a schedule full of like IUD procedures, which are birth control implants, and then the wellness exams. And then we have a few patients that are consults for different types of things. And then scheduling mammograms, taking phone calls for patients that call in, and doing the refills for the nurse practitioner, medication refills.
Today's is actually my day off, but I'm going to go back to the clinic today and make some phone calls and do some med refills for some of my patients.
Well, we appreciate you spending your day off with us. What advice would you give to someone interested in pursuing a career as a medical assistant?
So what would we say for somebody that's pursuing a career in medical assistant?
Yeah, if they were interested in doing what you do, what advice would you give to them?
I would tell them to go for it because it is a really rewarding job. You can work in so many different areas of clinic settings. You can do peds or express care like Maggie, or the OBGYN office like me. It's a very rewarding job, especially when you see patients over and over, or I like to see our pregnant women and tell them that they're pregnant because it just makes them so happy. So that's always fun too. But I would say go for it because it's a really rewarding job.
I would say go for it too. I start the career path in high school. I did phlebotomy and I loved phlebotomy, so I moved my way up to medical assistant, and it's been a great career choice so far.
Well, we appreciate both of you spending some time with us this morning. We will let you go, and we'll look for you down the road.
Thank you.
Thank you.
Thank you both very much.